everyone. Well, if you've been watching our awareness channel, you know that I'm supposed to be back in California and in the hospital already, and things are moving a little slower than we thought they would. The thing is, our lease in the place we're staying in Wisconsin runs out while I would be in the hospital, so we're trying to pack everything up and put it in storage while trying to get me back out to California and also get my daughter out there to get her enrolled in school. And it has been like a Charlie Brown move. I mean, I don't feel good. I'm not getting much done, I can tell you that, unfortunately. But my stepmom and sister are coming, and they're going to help, so I feel like I got super women coming to save the day, so that's a really good thing. But I didn't want you guys to think I was neglecting this channel. I'm not. I have been working on the dangers of steroid video. I finally got Series 1 done. It's up. I hope you guys check it out and share it. And I hope everyone's doing well, and I'll try to keep you guys updated on how things are going here. We're actually flying my son out here as well, and then he'll help. I'm leaving. My daughter and I are leaving the same day my son flies in, because my son's going to drive my dogs back along with some of our stuff, because we can fit more stuff in a car. And it's cheaper, actually, to drive the dogs back than to fly them back now. I mean, it used to be you could fly your dogs for like $70, and you know, now we got to pay like $200. It was cheaper for my daughter's ticket and my ticket, like $90 one way, and it was $175 before fees and taxes to fly each dog. Insane. Plus you have to buy those big kennels and everything else. And anyway, so we're putting a ton of our stuff in storage, and we'll decide what to do with all that later. Got a really nice living room set, and I don't know. I hardly ever see the living room set anyway because I'm so stuck in bed. But it's been quite a Charlie Brown thing. It's like I feel like things are getting done, and then everything goes crazy. And then I feel like things are getting done, and everything goes crazy. And because I'm late getting back, I'm a little worried about having enough medication to last me, so I've been kind of rationing, and so things have just been busy. I've not been neglecting the channel. It's just been really busy. So wish us luck on this, getting back there, and pray that things will go smoothly. And anyway, I just wanted to check in, say I hope everyone is doing well. And it's amazing. I want to say it's amazing that our healthcare system has come to this. I have to feel for those who can't do what I'm doing, which is going back and forth from state to state to get medical treatment, because when we couldn't get a neurologist in California, we had to come to Wisconsin. We come out to Wisconsin, we can't get a rheumatologist, and then I was left on high-dose steroids for too long because nobody but a rheumatologist would touch it, and they couldn't get me into one. And so now I have to go back to California to get medical treatment, and it's not cheap, and it's taken everything that we have. And there's people who can't do any of that, and they don't have family. I mean, I'm lucky I have family. So, you know, 23,000, I don't know if you guys know this. You guys can do a Google search on this, honest to God truth. Citizens, not non-citizens, but citizens. Over 23,000 American citizens die every year waiting on medical treatment. Did you know that? I lost 2 friends so far this year who were waiting on medical treatment. One who couldn't afford her chemo, and then my friend Joe, which you guys saw the video of, he couldn't get medical treatment until his body was just completely destroyed. And I just think it's a really sad statistic. I don't know why no one in the news is talking about it. It's a very real statistic. And that 23,000, that was on average over a 3-year period, and that does not count this year. This year, over 1,400 Americans are losing their medical insurance every day. I did not believe that number. I had to look it up when I heard it. I thought, surely they misspoke. I looked it up, and sure enough, 1,400. So when you think about it, if you can't get medical treatment without insurance, that means that 23,000 number statistic for this year, when those statistics come in on those who died waiting for treatment, it's actually going to be a lot higher. And it's really sad. You can also do, I've been researching this just because of my own difficulty getting medical treatment, but you can do a research in California. There was a study of children with asthma that were more likely to die if they had state insurance or did not have private insurance than those who had private insurance. So that kind of thing really breaks my heart and kind of put me on a mission to spread awareness about that as well, even though my main goal is to spread awareness on the other page about these connective tissue diseases and autoimmune diseases, I also want to spread awareness about these numbers, because no one on the news will talk about these numbers, and they're very real numbers. So I'm a lucky one so far, and I've been waiting a long time for medical treatment, and I consider myself lucky, because some people don't make it, and I'm hoping I make it, because I don't want to die. I want to see my girls get married. I want to see my youngest daughter graduate, and I hope that those who are against reform, I hope that they join this discussion, and maybe they could tell me why they would want me to not get medical treatment or not be able to buy insurance through the government or some other option when private insurance refuses to let me buy their insurance. I mean, I tried, and for no fee would they let me buy it. And I just want to know, honestly, not sarcastically, what it is that they would like us to do to get medical treatment. Because going to the emergency room doesn't really work. They just treat you for the day. They can't treat you if you're chronically ill. They can't give you treatment past what they're doing right then in the emergency room. And so I just, I'm kind of curious to those questions, why they wouldn't want me to be able to buy my own insurance, and so that I could get proper medical care. And not just me, but 23,000 Americans who die every year, and children with asthma and other diseases. So these are very real numbers. You guys can look them up for yourselves. You can Google these, and you'll be amazed at the research, what research is found by our own government and independent studies. So I didn't mean to get into all of that. I meant to just update you guys on my move, but can't help it. I guess I got more energy today or something. I just kind of segued into something else. Hope I didn't offend anyone. But look that stuff up. Look up those numbers. Don't take my word for it. I hope everyone's doing well. I'll try to keep you guys updated on everything that's going on here, and when we leave, and when I go in the hospital, we'll try to keep both channels updated on what's going on with me. Okay? Thanks. Bye.